course, let's begin with the rectum. And the rectum is the last portion of the large intestine and the final stop before feces are eliminated during defecation. While we talk about it, let's just pop it out and put it into the center just here. And as you can see, the rectum begins at the end of the sigmoid colon at the rectosigmoidal junction and ends at the anorectal junction. The rectum begins at the level of around about S2 to S3 and is around about 12 to 16 centimeters long, with a diameter of around about 4 centimeters, and this diameter dilates distally. Similar to the colon, the rectum is responsible for absorption and absorbs electrolytes, that is sodium, potassium and chloride, as feces pass through. And you can see the electrolytes moving out into the rest of the body in this little animation just here. In addition to electrolytes, water is also absorbed through the rectum, providing hydration and thickening the stool. But let's move on now and talk about the structure of the rectum. And one of the key anatomical landmarks in the rectum are the flexures, which can be defined as bends or curves along its length. Since the rectum sits within several planes, it has flexures that are found along its vertical length as well as flexures laterally. So let's look firstly at the flexures along its vertical length using this sagittal image of the trunk and the pelvis. And of course, let's pop it into the center so we can look at it a bit more clearly. And in this image, you can see that the rectum has two flexures in the sagittal plane. These are called the sacral flexure, or the dorsal bend, which is given its shape by the concavity of the sacrum, and the perineal flexure, otherwise known as the ventral bend, which forms due to the encirclement of the rectum by the levator ani muscle. And the levator ani muscle is located where the rectum transitions to the anal canal, which we referred to earlier as the anorectal junction. And you can see it dotted in blue just here. The levator ani muscle is formed by the puborectalis muscle, whose insertions are on the pubic body, slinging around the posterior portion of the rectum. And in the image on the left, you can see it slinging around the region of the anorectal junction, and you can see how it's inserting into the pubic body. Let's now have a look at the transverse flexures, and let's come back to this coronal image of the flexures. And as you can see, the transverse folds of the rectum, highlighted in green, create the three lateral flexures. And these lateral flexures include the superior flexure, which convexes to the right, the intermediate flexure, which convexes to the left, and the inferior lateral flexure, which convexes to the right. And of course, let's pop out our image so again we can see it more clearly. And as we mentioned, the superior flexure over here convexes to the right, the intermediate flexure over here convexes to the left, and the inferior lateral flexure convexes to the right, so that the rectum terminates in a medial position. Let's also name these green folds. So over here we have the superior transverse fold, over here we have the middle transverse fold, and down here we have the inferior transverse fold. And this little fold up the top just here, the mark of the rectosigmoidal junction. One last thing before we finish with this image, I just want you to know that the movement of the feces through the rectum flows in this direction. Let's now talk briefly about the relationship of the rectum to the peritoneum. So the relationship of the rectum with the peritoneum allows it to be divided into thirds. And of course, we have a superior third, which is intraperitoneal, a middle third, which lies behind the peritoneum, and an inferior third, which is extraperitoneal. And again, we're going to pop out our image so we can look at this a little bit more clearly. So in this image, we're going to draw some lines to divide our rectum. And of course, above the most superior line, we have the superior third of the rectum, which is intraperitoneal. And we have this orange shape, which represents the peritoneum. And when we say the rectum lies intraperitoneally, we mean that it's covered by the peritoneum on its anterior and its lateral surfaces. Between the superior line and the inferior line, we have the middle part of the rectum, which, as we mentioned before, is behind the peritoneum. So in the middle third, and therefore only the anterior surface of the rectum is covered by the peritoneum. Finally, the lower third of the rectum lies extraperitoneally above the pelvic diaphragm and is not in contact with the peritoneum at all. That's all we have for the function, structure and location of the rectum, so let's move on to the anal canal. So once the feces have passed through the rectum, it congregates and builds up enough pressure to move into the anal canal. The anal canal, as you can see in the image, is the terminal region of the digestive tract, and it has an important role in defecation and maintaining fecal continence. Let's pop it out, of course, for our closer look. And as you can see, it's around about 3 to 4 centimeters long, and like the inferior third of the rectum, it lies completely extraperitoneally. So there's no peritoneum covering the anal canal at all. And as I mentioned before, it begins at the anorectal junction and continues through to the anus. Let's now zoom in a little bit on this particular section, and we're going to talk about the anal canal's zones. Now, the anal canal can be divided into 3 zones, and these include a columnar zone, an intermediate zone, and a cutaneous zone. And of course, we're going to look at this a little bit more closely. So in our breakout here, you can see the anal canal divided into 3. And the first zone we want to look at is the columnar zone, which, as you can see, has numerous folds of mucous membrane producing column structures. And these columns are connected to each other at the distal ends by transverse folds, which are also known as anal valves. And behind these valves lie cavities where the excretory ducts of the anal glands open into. Let's move on now to the intermediate zone, which is divided from the columnar zone by the dentate or the pectinate line, and you can see that outlined in blue just here. The intermediate zone is about 1 centimetre in width and is made up of anal mucosa. Finally, let's have a look at the cutaneous zone, which is made up of perianal skin and progresses to become the anus. The final structures that control defecation are the anal sphincters. And there are 2 anal sphincters, an internal sphincter and an external sphincter. And of course, let's begin with looking at the internal anal sphincter. As you can see in this image, the internal anal sphincter surrounds the upper 2/3 of the anal canal and is made up of smooth muscle. The internal anal sphincter is permanently contracted by sympathetic tone and only relaxes with parasympathetic influence. Let's move on now to the external anal sphincter, which surrounds the anal canal like a clamp, surrounding the lower 2/3 of the anal canal. As you can probably see, there is some overlap between the internal and external sphincters, and this is to ensure fecal continence. And you can see that overlap in that grey rectangle I have for you there. The external anal sphincter is in close relationship to the puborectalis muscle, which we mentioned a little bit earlier. And both the external anal sphincter and the puborectalis muscle are voluntarily controlled.
If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.